Lori Wilson. I would also like to introduce to the panel Senator uh, Lola Smallwood Cuevas. And we are really excited that she is joining with us today. Senator Smallwood Cuevas was elected in 2022, representing the communities of Ladera Heights, View Park, Arlington Heights, Arlington Park, Baldwin Hills, Carthay, Century City, Cheviot Hills, Crenshaw, Delray, Downtown, Hyde Park, Jefferson Park, Lambert Park, Mar Vista, Mid City, South Los Angeles, University Park, West Adams, and West LA. So a huge swath of Southern California. Lola is an educator, a labor organizer, so dear to our hearts here at UHW, and community. She's raised by a single mother who worked as a home care worker, a CNA, and then a registered nurse. Senator Smallwood Cuevas has a life experience of being from a working family who's moved to California in search of better education, good union jobs, and a pathway to self-sufficiency. I could go on and on about Senator Smallwood Cuevas, but I'm really eager to hear what she has to say on this topic. So I'm going to welcome her to our panel. Welcome, Senator.
Thank you so much, Georgette. Thank you so much, UHW, for inviting me to the fireside chat. It's lovely to be here. And thank you so much, Assembly Member Wilson, for your leadership and your remarks. Really, really powerful. It's wonderful to celebrate Black History Month, and the theme is resist. And so I want you to know that we have Black women leaders at the Legislative Black Caucus in the state legislature who are resisting and contesting conditions that are the topic of discussion today. And we know that these things are so interrelated. As women, our lives are so intersectional. And so when we talk about maternal health, and particularly with this audience of healthcare providers, thank you for what you're doing, because you're on the front lines. You are providing that care, that quality care. You are fighting for patients' rights. You are fighting for Black women and Black mothers and our families to be able to thrive from day one. And we know that that is always a model of resistance. We start in the fight and we have to continue to fight for our communities. Coming from the worker rights movement and organizing in a non-union space with Black worker centers, where we were organizing low-wage, unwage workers, to organizing folks who were fighting for collective bargaining agreements under the union banner. We know that healthcare is vitally important. Quality healthcare, universal healthcare is vitally important for really addressing the issue that we're talking about. That preventative care, once we go into the hospital, and who cares for us, their cultural competency, their training, the diversity of care that we get, doulas, midwives, who all come under the banner of trained and professional individuals. We need a real, accessible, affordable healthcare system for all people. And we know that Black women represent the poorest population. When you look at us being heads of household, when you look at us not having multiple incomes in our home as in other people of color households, Black women represent the poorest. And so we know poverty is a key reason for why we have the disproportionate maternal and infant mortality rates in our community. So the fight for good jobs, the fight for real health care is one of the key ways that we can put a dent in this crisis. And we know far too many women don't have good jobs in our community. And we know far too many women don't have access to quality health care. Some of the statistics and the Assemblywoman shared these with you, but I wanted to just share with some of the stats that Black Women for Wellness and other organizations in the community who are focusing on this issue day in and day out have been educating me on a daily around this issue, is that Black women and our children are more than 3 times as likely to die or experience complications in childbirth or before our children turn 2 or 3 than any other group. So not only the infant part, but our young children through asthma and other conditions are far more likely to face the devastating experience of mortality and losing those members of our community. I want to say that, you know, the way in which we address this issue is one, we've got to ensure that until we get to full access, universal healthcare for communities, that we are building coalitions. And I really appreciate the work that UHW is doing, working with our nonprofit organizations that are on the front lines on these issues and building safety nets with groups like Black Women for Wellness, Planned Parenthood, and our other reproductive rights organizations, because it's not just about abortion care, right? It's about people's access to preventative care as well. And so when they attack reproductive rights, they're actually attacking our ability to have access to the full spectrum of maternal and infant health. And that is something that we have to fight against. Proud to stand with Assembly Member Wilson and other members of the Women's Caucus who fought to change California's constitution to make abortion right a constitutional right in the state of California, and to be a safe haven for other Black women, particularly those in the South, who are going to lean on California in many ways to be able to access the care that they need to ensure that our families are safe. I think the other thing that we have to recognize is that, and I sit on, this is week 7 for me. We fought for me to get to the California State Senate. I'm the only Black woman in the California State Senate. And the picture is increasingly clear that we've got to use our roles. And I sit on the Business and Professions Committee, which actually approves the licensure, the certifications for industry sectors like the nursing board, like IHSS workers, like from barbering to the California Medical Association. Our committee at Business and Professions approves those licenses. And so the questions we need to ask, and I really want you all to help us, because as we look at the California Medical Association licensing renewal, the nursing board licensing renewal, there's some things that are coming up. One, Black and other nurses of color, it's taking a long time for their licenses to come through. They go through the process, they've gone through board, they still don't have a license, they're not able to work. We've got to ask the question, why is that? How can we close the loop? How can we expedite the opportunity for culturally competent nursing professions to actually be able to go to work in good jobs? The other thing I think we need to pay attention to is, what are the cultural competency requirements for doctors in the field and for nursing staff who, you know, my mother was a nurse, and, you know, she was in environments where she dealt with so much racism, microaggression within her own teams, and would be sort of a go-between and a safeguard for our women and children. And I think that as people of color, we have to all work together to make sure that we are adopting and moving anti-racist approaches, but that starts with training. And so how do we make sure that as we are looking at these licensing processes, that we are embedding cultural competency in that? So I'm going to come to you all as we get ready for these licenses to come through, to really think about the questions that we need to ask, because at the end of the day, we know that part of this system that we're in, we have a lot of work to do. Institutional racism is real, individualized racism is real, and too often our families, when we come into the medical system, and we definitely saw that during COVID, we are at the intersections of those hostilities, and it affects our ability to get quality care. And in too many cases, the complaints of pain, the complaints of experiences, particularly related to pregnancy, You know, if it will happen to Serena Williams as a multimillionaire, it's certainly going to happen, you know, to a single mom who's coming from Florence and Normandy and trying to access care. So we've got to make sure that we are embedding in our training mechanisms and safeguards, ways to protect our folks against discrimination. And I'll close, you know, by just saying that I am authoring a bill right now to really protect pregnant and young mothers who are in the CalWORK system, because too often the attack on welfare benefits and the ability to force our pregnant and working moms into low wage jobs where they aren't able to take time off to care for themselves. They're not able to take care of themselves, to deal with things like lactation issues, to take care of themselves, to deal with things like I'm losing when you're pregnant. I've had 2 kids, by the way. When you go to get your prenatal exams, they're not able to get the time off. And then if they miss classwork or work responsibilities, they often cannot make that time up, and they're also penalized. I want to create a bill to give them accommodation for parenting and for being pregnant, so that when they need to take that time, they are not penalized and they're able to make their work and make their work up, both in class and in the workplace. So I would love to have your support in making sure that we move that bill forward. And with the Women's Caucus, we are putting together now a very powerful slate of bills that deal with more issues around maternal health, around childcare, around the issues that matter most to our community. So I want to just say thank you for this time. Thank you for all the work that you are doing. Thank you for being on the front lines. And we look forward to continuing to fight the fight for mothers and women that deserve and to have the best opportunity and the care that they need.
Thank you, Senator. You touched on a lot of things that I know our members are going to be really eager to jump in and on and support. I want to ask this question to the whole panel that kind of goes a little bit even more depth into some of the things that you touched on, Senator, is how can we involve Black women in communities in the design and implementation of interventions to improve maternal health outcomes, and what are the benefits of doing so?
Well, I think it's what we know, it's old-fashioned organizing. And it's, you know, reaching women where we're at, right? We're not going to be on the public health website, right? We're going to be in our churches. We're going to be in our community colleges. We're going to be in shelters. We're going to be in community spaces. And I think what I have found the best way to really share information, and particularly to get access to government resources and access to healthcare, is by building and institutionalizing those partnerships with folks who already have the relationship with women in our communities. Women of color know how to connect and network. We do it in unconventional ways, and I think it's important for us to reach out across our unions, across our CBOs, across our church institutions, across our clubs, and find women and bring them into opportunity. You know, the digital divide is real. And sometimes, you know, maybe we have to use text messages. Maybe we have to go and door knock in those places where we haven't been able, where we see the most harm and the most need, and make sure that women are engaged. But I think in my experience, women, and particularly women who are in low wage work, folks who are in need, they recognize opportunity. And if we can frame this as an opportunity to be able to sustain themselves and their families, I think this is something that I've seen women, you know, really respond to. But it's something that we all have to do together. No, I really do appreciate that analysis, and thank you so much, Makisha and Dr. Wright, for that framework. I internalized racism, bias. We know it exists, and it's in the air we breathe. It's the ground we walk on. It is deeply entrenched in our society. I think what I think is most uplifting, and I think Makisha pointed to this, is that the ability for our folks to say that we deserve, like, to fight that internal racism, to say that, oh, I can't speak up, or I can't be seen, or I'm going to be invisible and just nod my head and not engage. I think this idea of us fighting against that and really saying, I deserve quality care. I deserve to be heard. I deserve to be seen. I deserve to be felt. I think that is such an empowering tool that will serve our women and our girls who are going through this process. But I think just for women overall to be able to have that kind of voice. And I think we talked about the spaces and places, like, where do we get to develop that voice? And I think this notion of investing in community space and putting on the table this question of reproductive care and this question of maternal health care, and that our young women, that we can say that we deserve, right, to be treated like the human beings that we are, and fair and equitable care and service. So, we see this in so many places and spaces where the harm has gotten to that point where we don't know how to advocate, or we are afraid to advocate for ourselves. And I say that, within our union, and the work that you all are doing, the access that you have to community, I think you all sharing this information is so very empowering with your members, and also with the patients that you come in contact with. How do we help to invest in that opportunity? I think is, one of the things that we are looking at the state is, how do we really arm our communities with the resources to look at this holistically, and again, to reach women where they are, and to help develop that voice to fight against some of that internalized oppression that we often struggle with in our communities. Your local representative can help you with that. I'm happy to follow up and talk offline with you and give you my information, but you can definitely file complaints in a number of places. One, in the facility where this took place, there is a process, an ethics process, that you can go in and to file a complaint there. You can also, I'm learning that the California Medical Association also has a process. And certainly we would be happy to support any correspondence and additional correspondence from our office to support you. We know that our communities get mistreated in this space. It's a historic, our relationship with the medical industry and sector has been a very complex and deeply rooted experience. But during COVID, we just saw in real time these experiences. And one of the things when I, as co-founder of the Black Worker Center, there was no hotline to report what was happening. And that's something that I think Supervisor Holly Mitchell has brought to the county, to be able, through her equity, racial, anti-racism and equity index work. There is an equity department at the county too that is looking at particularly impacts of COVID that can also be a resource for you. So I want to say that we learned a lot through that crisis and of trying to set up systems for communities to be heard. And I'm happy to connect with you. I'll put my information in the chat so that we can follow up.
I'm going to let Senator Smallwood Cuevas bring us to a close.
Well, thank you so much for this rich conversation and all the knowledge sharing that is happening here. Knowledge is power, right? So this opportunity to share resources, links, conversations, just so important. I just want to say that, I am an ally in the California State Senate. I am following in the big shoes of now Congresswoman Sydney Kamlager, and before her the dynamic Senator Holly Mitchell. And so, our work continues, and we cannot rest on this. So I invite you, I shared my contact information, my district director who's in Expo Park, that's where we're located, our district office, right by the California African American Museum. I shared Kirk Samuel's name. He's the district director there. Would love to connect and figure out ways we can monitor and protect the resources that we have in the state budget around Black maternal care, and to also figure out ways to deal with, I think, the issues that Gabe talked about, which is at the end of the day, the compounded poverty that too many of our women are in, that disenfranchises us from the quality care that we need. And that is part of the work that I am leaning into at the state Senate. I mentioned my bill on parenting and pregnancy protections, also pushing for things like severance pay for workers who are laid off so that their benefits can travel with them during this time of mass layoffs as we see them taking off, dealing with issues of retaliation when women file complaints about working conditions, be they safety, labor, wage and hour, that they are protected from retaliation. These things are interconnected, but as Audra said, the explicit call in for our women and our babies and their care in the places where they should be safest and healthiest is a top priority. And I look forward to working with you all on this issue moving forward.